So, hi, Dr. Michael Mison. Welcome to the Inspo Talks. I'm excited to have you, the Associate Dean of Veterinary Medical Center Operations and Chief Veterinary Medical Officer here at the vet school with us today, where we'll dive into some residency training and applying skills, how to become a successful surgeon, and how to not get burnt out after many years of being in school.
Sure.
Yeah, so
well, thank you for having me.
Yeah, thank you so much for being here with us today. Do you mind introducing yourself?
So, as you said, I'm Dr. Mison. In a sense, like the title that you just said, to like make it a little bit more easy to understand, I'm the hospital director.
There you go.
For the veterinary teaching hospital at UC Davis. So the veterinary medical teaching hospital has the small animal hospital, the large animal hospital, the livestock, and all other kind of remote clinical areas.
Yeah.
So I oversee the kind of clinical operations there.
Nice.
Yeah.
Nice.
So I went to undergrad and vet school at the University of Florida, so double gator.
Yeah.
And then, kind of during vet school, and, we can dive into this if you like, but, in a sense, there's so many career paths, and I chose to specialize in surgery. So I did my internship and my surgery residency at Michigan State.
Oh, nice.
So I was there for 4 years, and then I took on some faculty positions at Washington State University before opening up actually a private specialty practice in Seattle.
That's pretty cool.
So then the practice got sold, and then I transitioned to the academic world.
Nice.
So I moved to Penn, and so I was the hospital director there at Penn, plus a surgeon. And then my alma mater called, and so I moved back to Florida.
Yeah.
I never thought I was going to go back to Florida, but here I am, or here I was.
Yeah.
There I was at Florida, and then UC Davis came calling, and it was a fantastic opportunity. It's an opportunity that was hard to pass. And so now I'm here.
Yeah. So when we're talking about residency training and applying, what would someone need to know if they're applying for this residency application, especially after being in vet school for 4 years?
So really, the residency application comes after an internship. Right. So typically, most vet students start talking about it kind of in their maybe third year, around fourth year, because in a sense, a internship and a residency is, in a sense, like 100% clinical immersion on whatever specialty you choose, right? So the internship is generally a rotating internship is what we call it, right? So you basically go to an institution, be it a university, or you go to a private practice that have rotating interns, and you rotate through all the services, emergency, surgery, internal medicine, cardiology, neuro, all those things, immediately after you graduate from vet school. And so it's kind of like the baby doctor stage.
Yeah,
right?
yeah.
During your fourth year in your internship, then you kind of realize if you've gravitated towards a particular specialty.
Yeah.
So for myself, surgery. Although, interestingly, when I was a fourth year and during my initial part of my internship, I thought I was going to do internal medicine.
Oh, wow.
It was either going to be, it was either going to be internal medicine or zoo and wildlife. Those are my two things. Surgery was not even in the radar. And then, anyway, during your internship, you find what you're calling, so to speak. And then you start applying for the residency, right? As a vet student, in a sense, when you apply for an internship, you go through what's called the VIRMP, and that's a Veterinary Internship and Residency Matching Program. Right. So the match, right? And actually, our human counterparts will have the match as well, and it's the same process, right? So as a vet student, you will apply to many schools. The schools will rank you. You rank them. It's almost kind of like speed dating.
Oh, yeah, literally.
And then wherever you match is where you go, right?
Wow.
So that's the internship. After the internship, you do another match cycle for your residency.
Okay.
And so, certainly some specialties have a lot more applicants. So sometimes it's a harder residency to get than other specialties.
Right.
So I think for a vet student, they need to start kind of thinking about it around like maybe their third year or so, because ultimately when you get to clinics on your fourth year, you need to start talking to clinicians, right? Because you need letters, or you need extra exposure to things and whatever else, and then the match comes. So typically the deadline for the match is December.
Oh wow.
Of that senior year.
Oh, okay.
Right?
Okay.
So usually when you're starting clinics, which they're starting clinics now, they need to start figuring it out, right? Because it opens in October with regards to starting the application. And then you look at all the programs, you talk to interns there in that program and everything else. So many things to do between the start of your clinic and the deadline of application in December.
Oh, yeah.
And then you wait.
Oh, gosh.
Until match day.
And what is that?
Usually it's March.
Wow.
So you wait. You apply, you rank, and then you wait. And then around March, the big reveal.
Oh, gosh.
And then it's like, you are going here. And then there you go. And then you start it all over again for the residency.
Yeah.
Yeah.
Awesome. And then what would you recommend? Applying right after vet school, or do you want to is it better to take a year off?
Yeah, good, very, very good question. I think ultimately it depends on the person, but from the other side, coming from the other side of like screening applicants and things, it's very familiar for people. Like when they finish vet school, to then do the internship and then do the residency. So it's almost kind of like there's no question mark as to what happened in between, right? Especially also if like begets like, so to speak, right? So you're already in an academic institution as a vet student. Let's just say that you want to do an academic internship. They're already in an academic institution. And so the networks and the references and everything else is kind of pre-established, right? So it's a little easier as opposed to you're a fourth year and then here's an academic institution and then you kind of leave that sphere of whatever you call it, networking. It's harder. Doesn't mean it's possible. It's impossible, but it's harder in that way. So from the screening, it's an easier process. Like people don't have a question mark. So what did this person do? Now, that being said, some people choose to kind of stop for a year or work in private practice for a year, or even like do some research or something like that. Not a problem, right? But I would say that the clearest path is vet school, internship, residency. Now, sometimes, depending on the specialty, you have to do a vet school internship, then a specialty internship, and then a residency. So basically, and I'll speak to surgery because that's kind of my background. You do your vet school, and then you do a rotating internship. And then you apply for a residency and a specialty internship. If you match for a residency, fantastic, right? But if you don't match for a residency, you could do a specialty internship. So basically, that entails a full year of just surgery. Not residency training, but like another internship, so to speak. But now you're not rotating as much. You're just doing surgery, right? Or, here at Davis, we have specialty emergency and critical care interns. That's all they do is emergency and critical care. So it's just another hyper-focused year for that discipline, which the hopes is that it prepares you to be a better candidate for the residency training. So in a sense, going back to your question, that direct path, if you stay in that lane and not veer, it's the easiest path. But if you feel like you need to take, some time, either be it break, be it research, or you're not necessarily 100% committed yet, like, I don't know if surgery's the thing, but I'm still interested. There's certainly pauses and it's perfectly fine.
And then good question, how do they grade you during this internship period? How does that work? Good
question, because it's not a grading anymore, right? So to get to the internship, sure, I think grades and class ranking still kind of count. And then same thing for internship to residency. They still look at that objective criteria because like on your VIRMP application, they will still look at, where you did your vet school, your class ranking, your GPA. It's all there, right? But as you kind of go further and further along in the training, that becomes less and less of the bigger percentage, but it's more so your clinical aptitude and performance.
Oh, okay.
Right. So how we grade, because they don't receive a grade, right? How we grade interns is really more kind of, and I don't want to call it soft skill, but I'm going to call it soft skill. And then there's the hard skills, right? So obviously how you do well in clinics, your kind of critical thinking, your knowledge base about disease processes and everything else. How you synthesize information, right? Because now you don't, it's not just pharmacology, right? It's everything. It's pharmacology, it's surgery, it's whatever, kind of thing, all radiology and things. And you synthesize that information to come up with a diagnosis and a treatment plan and everything else, right? So it's the way they critically think, the way they kind of manage cases and patients, the way they interact with students. Because now they're working with students, right? So I think those are all kind of things, and how they work with staff, how they treat the vet techs, and everything. That's really important, right?
Yeah, it's super important.
But then kind of on the softer side, how are they with clients? We deal with clients that, their loved ones, their beloved pet, or their prized possession, horse, whatever it might be, is in our hands to help them heal, right? How do they manage that, from great news to bad news?
Right.
And so all of those kind of come as an aggregate in terms of how they grade an intern. And then same thing as you transition for residents. So residencies are a little bit more regulated. So every specialty has a college of. So meaning, for example, myself, so I'm a diplomat of the American College of Veterinary Surgeons, right? So there's American College of Veterinary Internal Medicine, American College of Veterinary Radiology, all of that, right? Each college has, in a sense, a very specific guideline on year 1 residency, year 2 residency, year 3 residency, right? And so then you look at your case logs, how many cases you cut, your seminars, the rounds you did, and everything else. And so then every time you're evaluated before you move on to year 2, and then before you move to year 3.
Right.
So all of those are kind of aggregated until basically like you meet all the requirements, right? And then you take the dreaded exams, so the board exams. So for internships, no exams, right? Some internships require like a seminar, plus, all the clinics. And so, that's all aggregated into your residency application, and your letters are critical, because this is basically doctors being advocates for you to say, this is a phenomenal doctor, take him for the residency, right? Because of XYZ. Now for the residency, there's specialty boards. And so it either comes in one big phase or it comes in multiple phases. But to become board certified, you need to go through those board exams. And then once you pass your board exams, then you're fully fledged.
Oh, nice. And those board exams, are they written or are they just...
It varies.
Oh, okay.
So depending on the specialty. So again, I'll speak to surgery. So back in my day, when I took boards, it's a 3-day exam. So the first day is written. So it's an 8-hour multiple choice.
Oh my goodness.
And then the second day is like slides. So like 25 slides and then kind of, free form type of questions. And then the third day is an oral exam. So you actually, somebody's talking to you like you're talking to me and asking you about cases and things. They've since transitioned it to now you take a phase 1, which is after your second year.
Okay.
Or during your second year. And it's all multiple choice.
Oh.
And then when you finish, then it's a combination of multiple choice and case-based kind of questions.
Nice.
So that's for surgery.
Okay.
Medicine does the same thing where it's 2 phases. But, obviously like zoo vet will have a completely different format.
Oh, wow.
Path will have a different format and things. And obviously during your residency, your mentors are training you on how to complete and pass those board exams.
Right. So mentors are very important.
Mentors are huge, yeah. And I think a lot of colleges actually do require that you are assigned a mentor, right?
Nice.
So there's a residency program director, right? So, and I'm just going to use it here at Davis. So we have multiple program directors of the specialties, right? And they basically oversee compliance, right?
Nice.
But within the specialty, you can choose a mentor or you can be assigned a mentor, be it because you knew them before or they have the same research interest that you are interested in. So it varies in that, but they're kind of your Sherpa to kind of guide you through the process of not just completing the residency, but also passing the boards.
We're talking about debt.
Yes.
How do you think you could manage the debt after coming out of vet school and then going straight into residency, internships?
Yeah, that's hard, right?
Yeah.
Because I think overall there's a considerable amount of debt that you could potentially accrue during your vet school. And the thing is about it is that, it is tempting after you're done with vet school and you go to practice and you can earn maybe at least around 2, maybe even 3 times as much as an intern or as a resident, right? It's hard.
Yeah.
Certainly in depending on your loan and things, you can potentially defer it, but still there's interests and everything. So it's not like it just sits there.
Right.
So I think the thing about that is really more your earning potential afterwards, right? So meaning that you're a general practitioner after vet school and, there's a salary range that kind of varies from state to state and region to region, but there's a range, right? If you then do a specialty in something, now depending on your career path, academic versus private practice, and depending on your specialty, you then have a very exponential earning potential.
Okay.
So meaning, and I'm going to stick with surgery, right?
Go for it. Yeah.
So if you stay in academia and, become a faculty, like our surgeons here at Davis, you're going to make more, but if you decide to go to private practice, for example, you're going to make a lot more. So, you could probably make about 2 to 3 times more of what you would make in an academic institution. Now, your purpose and what you do and what kind of makes you tick is very different between academia and private practice. So there's pros and cons for each. But that being said, your ability then to pay off your debt afterwards is a lot higher once you become a specialist.
Right.
And that's true too. Like most specialties out there, once you become a specialist, on average, you will make more than the range of a general practitioner.
That's true.
Right?
Yeah.
And so it is really more the earning potential. I think you just have to figure out a way and how to manage that for 4 years, 5 years kind of thing, to be like, okay, how do I kind of control this debt, knowing that I can pay this off and I'll have a lot more earning potential afterwards, but there's still this kind of debt that sits in there.
Right.
That needs to play in your kind of decision-making processes. So, I mean, I do have, I've worked with, interns and residents in the past where, in a sense, what they decided was they worked in practice for a little bit, made it so that they're a little bit more financially secure, and then went back into the that's the fast lane.
Yeah,
right?
the fast lane.
They went back in to be like, okay, now that I'm more financially secure, I'm more mature, I know what I want. Let's go in.
Okay.
And so then now they've paid off some of their debt, and they're a little bit more in a financially comfortable place as they do their kind of next level training.
Right.
Yeah.
That makes sense.
Yeah.
And then when you're talking about the internship rotations and things like that, does that also cost a lot? I don't.
Well,
How does that work?
you're getting paid.
Okay.
But not a lot. So you're getting paid. So what the cost to you is really your living kind of thing, right? So you're a fully fledged veterinarian because to be an internship you have to have graduated.
Yeah.
You have to have passed boards.
Yeah.
So you're a doctor, right? But because you're a doctor in a training program, the pay is less because there's still a training component to it.
That's
right?
true. Yeah.
So you're earning, but you're not earning as much as you could have in private practice, knowing that you're getting additional training things.
Yeah.
Yeah.
Makes sense.
Yeah.
Awesome. And then what do you think made you such a successful surgeon?
That's a weird, I don't know. I think part of it is just that I fortunately learned that this is kind of what I wanted to do, So again, as I told you before, I was going to do internal medicine and zoo and wildlife, or zoo and wildlife. And actually, during my internship, I applied for an internal medicine residency until November. And then I changed my mind for the December deadline.
Wow.
To surgery.
Yeah.
And it is really because, at least the surgery, there's an endpoint. You can kind of complete the procedure to kind of, heal a patient and things. And then there's the kind of the tactile component, the procedural component of it. And then it crosses species. So being that I had a strong interest in zoo and exotics, right, then physiologies for bird and reptile and mammalian are very different.
Right.
But the surgical principles remain the same, right? So then it allowed for me to kind of do my other interests because kind of like the fundamental skills of being a surgeon can cross species.
Yeah.
And so it really is kind of fortunate that I found that what I kind of like to do. And so it wasn't so cumbersome for me to do it. And so here we go. That was it. It's hard to say successful, but you know what I mean.
Yes, you are. Yeah.
Yeah.
That's incredible. Yeah. Awesome. And then what are some tips and tricks when going through this residency process? Yeah. What do you think are those? I know you mentioned mentorships, right? Yeah. For those letters and recommendations. Yeah. Do you have any other? So
definitely I think again, it all starts in the vet school, right? Mm-hmm. It all starts in vet school. I would say some tips, like if you are in the beginning of your vet school and you already know, right? Be it because you've worked with surgeons in the past or you really just have a passion for specialization of some sort, I think start reaching out to faculty. Not aggressively, just the right amount where you're like, Dr. So-and-so, I'm interested in XYZ. And then start looking for opportunities, right? So be it opportunities in the clinical experience. Mm-hmm. So we have vet students that are, working and doing some volunteer time and whatnot. Again, in preparation for the next step. Mm-hmm. We have vet students doing research.
Right.
Yet another things, right? We have vet students, kind of like you, where, you've kind of engaged faculty members.
Right.
Like this podcast is a great idea.
Yeah, thank you.
It's like some extracurricular stuff.
Yeah.
So I've had vet students where they've led trips,
nice.
Be it like spay neuter things or like low cost something or other and whatever. Things like that. Yeah. Or like open house things, whatever it might be. Kind of start engaging.
Start
right?
somewhere.
Start somewhere.
Right.
Take all the opportunities you want. So I think that's one tip. I think the other tip is, just aim to do your best in clinics, because, again, like the letters are very significant in kind of your success in matching. Because if you think about it, so here's an example. We don't have a rotating internship at UC Davis, not quite yet.
Yeah.
But I'm using University of Florida as an example, right?
Right.
So we have 13 rotating interns, right? We have about 900 applicants.
Oh my gosh.
Right? So, and then now you go on to the next level.
Yeah.
So now you have a surgery residency, right? We take 2 a year, so we have a 6. That's right, I think. It's going to be 3. Anyway, we get 300 applicants, right? So if you think about it, in the application and on paper,
right,
everybody's going to look phenomenal, right?
Exactly.
So do your best in looking phenomenal.
Yeah.
And again, use all the opportunities. And it doesn't all have to be research. Research is fantastic, and I think that's great. But also kind of engagement like this.
Yeah.
I think if you write this on your CV, it's going to mean a lot,
great,
right?
yeah.
And all those other extracurricular things. But like now you have 900 applicants, of which let's just say 300 looks the same. You're like, oh wow,
Yeah.
So what sets you apart? Like what rises you to the higher rankings, right?
Yeah.
And that is all the networking. Yeah, it's like, I know you, I can advocate for you. You're going to be great as an intern. And, the universities and private practice will kind of get that idea. So it's like, okay, bump it up kind of thing, right?
Yeah.
So that I think is another kind of tip is like, yes, do your thing to set yourself apart on paper, but do your thing to set yourself up as a person so that they can kind of speak to you as you, not speak to you as your application, right?
There you go.
And I would say, just keep having fun. It's hard work. It
is, yeah.
And I think I think sometimes you kind of have to remember you worked hard to get to vet school, and now you have an opportunity to do like great things.
Oh, yeah.
In whatever industry, whatever path you do, like industry, research, clinical, academic, whatever it might be. And so sometimes it's just a reminder to be like, yeah, this is actually fun, so that you don't get kind of lost in the weeds or lost in the forest of kind of like the hard work, because it can be hard, could be long hours. And, I think use your classmates as support and network. Yeah, absolutely. And yeah.
Awesome. That was exactly my other question. So how do you not get burnt out after so many years of studying? So that's a big one.
I think definitely support system, right? Make sure that you develop, peers can help you through things. Obviously, we talked about mentorship, right? Because they've been through it, and so they can kind of guide you if you're doing too much, kind of thing. And then just, it is really important that you do need to find time for yourself in whatever makes you happy. Yeah. And it varies from person to person, be it, taking some time to do recreational things or reading things or whatever it would be. Like, I think you just need to make sure that you don't forget that is important to take care of you. And I think we are better now as a profession to recognize that its value. And I think we're better now. UC Davis has things to kind of help facilitate that and foster that and encourage that, right? So that we kind of minimize the burnout that, is sadly a little bit more prevalent in the profession, so that you don't burn out. You just kind of burn through it in a sense. And, come to the other side with some support. But I think it's important. kind of identify things that you like to do. Make sure that you have a peer group. Utilize your mentors. And take some time. Take some. I mean, you people go to vet school because they love animals. Spend some time with your animal.
Yeah,
like
that's a good one.
Ride your horse, walk your dog, play with your cat, whatever it might be. Like, those are things that just kind of make you realize why you're doing it. And obviously, I think family network, if that works for people too.
Right. Everybody's different. Everybody has different. The relaxing times.
Everybody is different. Yes.
Yeah. Awesome. And then the question that I always ask all my speakers, that you're actually the second person to answer this question, which is amazing.
Yeah.
Wasn't an inspirational quote that you abide by, and then why?
Okay. I was thinking about this when you mentioned this. So this is a quote by Pablo Picasso, so an artist.
An artist, yeah.
Yeah, so not a scientist. But he said that and I might be paraphrasing, he said, the meaning of life is discovering your gift. The purpose of life is learning how to give it away. Right?
That's beautiful.
So I think kind of coming from educational things, as we talked about vet schools and internship and residencies, the meaning of life is to discover your gift or find your gift. It really is like discovering what you're passionate about, right? And if it's vet school and veterinary, great. And then let's move on to specialty. Is it surgery? Is it something else? Whatever else? So there's that, right? Mm-hmm. But then the purpose of life is to learn how to give it away. So meaning, how do you share that passion and your gift of healing? Right? Be it from a surgery side or your gift of teaching and sharing what you learned as a surgeon and pass it along to the next generation. Right? So when you kind of had that question, I'm like, yeah, I think, that definitely resonated in terms of the topic that we're talking. And I think kind of overall for kind of inspiring undergrads that want to be vet students that want to be interns, and interns that want to be residents, and residents that want to be specialists.
There you go.
Yeah.
Yeah, it's a whole chain.
It's a whole chain.
Yeah, everybody inspires everyone else. And
correct.
If you have that knowledge, might as well just pass it on.
Pass it on. Pass it on in a way of passing it on to the students or passing it on to the animal.
Right.
And when you do that, you pass it on to the family members that love that animal.
There
right.
You
so
go.
I think it's just kind of learning how to share that.
That's a beautiful quote.
Yeah.
Yeah, thank you for sharing that.
Oh, my pleasure. Yeah.
And thank you so much for being on Vet Inspo Talks today.
Thank you.
And thank you for sharing your knowledge with us. I hope a lot of people did